The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. We're glad you joined us today. Today we're going to be talking about an important topic, especially, well, we're going to find it's not just for vegetarians, but for people who eat. Do you eat? You may be interested in today's topic. And joining us today to talk about vitamin B12 deficiency is Dr. George Guthrie. Dr. Guthrie is from the Lifestyle Center of America in southern Oklahoma. He's been a physician for over 20 years, 25 years. He has done family medicine. He's also taught at the Loma Linda School of Health, and we're glad you're with us today.
Glad to be here, Don.
And you are spending some time there in the Lifestyle Center of America. What do they do there?
At Lifestyle Center of America, we have a live-in lifestyle program where people come with their health problems. We focus on type 2 diabetes, and we help them treat their disease with the lifestyle components, minimize the need for medication.
And there's lots of other programs now that are starting to come out of that center, not just diabetes, but also sometimes all different types of programs that are lifestyle oriented.
We work with Dr. Neil Nedley with a depression program, and we're planning a special heart disease program with Dr. Hans Deal.
Okay. So you have all kinds of things coming out of there, and your lifestyle approach, many times you come across or at least think about this problem of vitamin B12 deficiency.
Yes.
So tell us, what is vitamin B12 and how big is this problem?
Vitamin B12 is obviously as a vitamin necessary for our bodies. It's a very complex vitamin. It's kind of fun to look at its structure, at least for biochemists. It's got a little cobalt sitting in the middle and almost a plane of carbons around it, and then there's a kind of a little structure above and a little structure below, and this complex structure makes up what we call vitamin B12.
So when you look at it, you can't believe that it just popped into existence.
Oh, no, it doesn't pop into existence. The little vitamin B12 complex is actually made by bacteria.
Bacteria?
Bacteria. Plants don't make it. Animals don't make it. Only bacteria make vitamin B12.
And they can make something that complex?
Yes, they do, as a matter of fact. I was fascinated to learn several months ago that bacteria make it with two different, completely different kind of formulations. They had two different ways of making this same complex vitamin B12 molecule. It almost seems like the creator was trying to leave his tracks. You see, here's this incredibly complex vitamin molecule that bacteria have two separate ways to make. It kind of flies in the face of evolution to me.
Well, yeah, I guess so. And you know, it's like a quarterback has like 64 different ways to get to the end zone, and bacteria have two ways to make vitamin B12. So, what does it do?
In our bodies, see, the biochemistry of it gets a little confusing to people. We have this little thing called a methyl group, a carbon with some hydrogens attached. Its job is to do those type of transfers in the body. It can happen in a variety of different places. The areas that we think of most are the nerves, the blood, and then there's another area that's called homocysteine. Maybe we should spend a little time talking about those.
Okay, yeah. What about the blood then?
In my training, when I was taught about vitamin B12 deficiency, I was taught that vitamin B12 deficiency shows up as an anemia.
Which is a blood problem.
Which is a blood problem. There's not enough blood. Some people call it low blood. The body needs the vitamin B12 in order to put together the hemoglobin molecules. When there's not enough of the vitamin B12, it has a hard time separating the cells. They end up being large, and there will be few of them.
Okay, so if you don't have enough vitamin B12, your blood is affected.
You're likely to have thin blood, that is anemia. And I was taught that was the way we looked for it. We looked for it. If there was anemia, we said, oh, maybe there's a B12 deficiency.
Is there a specific blood test for it?
Well, just the regular, what we call a CBC, will tell you if you're anemic and if the red blood cells are large. That would mean that it could be, we would call it a macrocytic anemia, macro large cytic cells, so large cell anemia, and that's a common cause of that would be
But there's no
vitamin
specific
B12.
test for B12.
Oh, there is a blood test, yes.
There is.
Yes, you can measure a vitamin B12 level in the blood, but that's not done, in my opinion, nearly as often as it should be.
So you order those at the Lifestyle Center of America?
We do them on everybody that comes in as a matter of screening.
So you said it affects not just the blood, but also it can affect the nerves.
The nerves. Most of the B vitamins are important for nerve function. Vitamin B12 is important for nerve function as well, and it can present in a lot of different and interesting ways, from depression, anxiety, irritability, to shooting pain in the nerves. It's important for nerve function.
And if it's not there, you get, what does it do when it's not there to the nerve?
Well, the nerve doesn't function properly. I think it's probably the best thing to say. A sick nerve is not passing messages like a healthy nerve is, and the symptoms vary, but they're often involve the nerves. I think maybe in the second half we've got
We'll talk about that
about that a little more.
Okay, so the nerves, and supposedly depending on where the nerves are that it affects would be the symptoms. So you have the blood, and you can test that by, gives you a hint by just a typical blood test, but there's a specific one, and then the nerves.
And then the nerves.
There's no real test for that. It's just more symptoms.
Well, if the doctor is suspicious, then the doctor would order a B12 test, and if it was low, why then would be suspicious that there may be a connection.
Well, what about homocysteine? That's a big word. What does that mean?
That's a big word.
Yeah.
It is. This one is rather interesting to me. Homocysteine is made from an amino acid called methionine. Methionine is generally a protein. It's got a sulfur attached to it. It's generally high in animal products. When we eat those, it's in plant products too, so it's not like it's only in animal products. This methionine is taken into the body, and as the body changes that and uses that methionine, it turns into homocysteine. But homocysteine is toxic to the cells. The body knows it doesn't belong there. If your level goes up, the lining of the blood vessels gets irritated, inflamed, and it increases the risk of heart attack. Now, you might ask, how does vitamin B12 fit into this?
Yeah, that's exactly what I was going to ask.
Well, vitamin B12 is an important part of the breakdown mechanism for the homocysteine. So homocysteine can be recycled back into methionine for the body to use again as a protein using B12. It could also be thrown away using a couple of other B vitamins like folate and pyridoxine.
Okay, so
vitamin B12 is really important, along with these other B vitamins, in helping to make sure that homocysteine in the blood is not too high.
So it's kind of like the trash collector going down the street.
Well, I don't think of it more. This would be a recycling system, rather than the trash collector.
Yeah, the recycling guy.
This is the recycling guy going to pick it up and recycle it again. The homocysteine will put you at high risk for heart attack. Really, the higher your homocysteine, the higher your risk of heart attack. If our B12 level is low, that can increase the homocysteine and increase the risk of a heart attack.
So it's kind of what I mean with the trash man is he comes by once a week. He has that recycling bin and he has the trash. Some things he throws away, some things he recycles. But if he doesn't make it for 2 weeks,
it's bad news.
Yeah, your wife's going to have a heart attack. So B12 then, it affects the blood, and it what was that again? It causes them not to get anemic if you have it.
Yeah, that's right. That is, low vitamin B12 can end up in an anemia.
And then secondly, the nerves, and those are different symptoms, but they don't work right if they don't have B12.
Right.
And then the homocysteine, which is very toxic to the linings of the vessels, and if we don't take it out, it's going to take us out.
Very likely to. That's correct.
All right, then. Well, let's move on.
Okay.
Who is at risk for difficulties with vitamin B12 deficiency?
Generally, we think of vitamin B12 coming into our diet from animal products, right? So we would expect people who don't eat animal products to be at high risk for vitamin B12 deficiency. Does that make sense?
Well, sort of, but do we eat bacteria? Because I thought you said vitamin B12 is made from bacteria. I've never gone and ordered a batch of bacteria.
Okay, now that's a real interesting question. Vitamin B12 is made by the bacteria in your mouth, Don.
Okay.
Some have said, and I think a bit jokingly, because I don't know that this has been proved, if you didn't brush your teeth so often, maybe you'd get a little more vitamin B12 from the bacteria in your own mouth. Now, don't tell my dentist I said that, okay?
I won't mention it. Okay.
And what's more, the bacteria in our colon also make the B12. But we don't like to have things from our colon get anywhere near our mouth. We generally throw those away for obvious reasons. So the B12 that we get generally will come from either bacteria we've ingested or an animal that has made the B12 or taken the B12 from the bacteria and stored it in their tissues.
Okay, so animals need B12 too, and if we eat the animals, we get the B12.
For example, a cow has bacteria in its colon which are making, in one of its many stomachs, that are making vitamin B12, which the cow will absorb, and then if the cow is eaten, then we get the B12. So that has been the focus for the nutritionists through time, and that's why they worry about people who are, do I dare say the word, vegetarian, getting B12 deficient. As a matter of fact, there are a number of studies that demonstrate that people who eat a plant-based diet are more likely to have a vitamin B12 deficiency. They're at risk for that.
So at the Lifestyle Center of America, I think you use a plant-based regimen.
That's correct.
And so you think about this a lot, and probably lots of people ask you about it every day. So do meat eaters then, you know, if you're eating meat, seems like you'd probably never have a deficiency. Is that right or wrong?
Most of the people that come to Lifestyle Center of America for help are actually meat eaters.
Oh, is that right? They have a lot of problems.
And it ends up that they've got quite a few problems with the vitamin B12 deficiency.
So even though they're eating meat, they have a deficiency.
That's correct. In some studies looking at free-living people over age 65, we're looking at somewhere in the realm of 15% of people actually deficient in vitamin B12.
We're talking with Dr. George Guthrie. We're talking about vitamin B12 deficiency. Interestingly enough, it's not just something that plagues people that are eating a plant-based diet, but now we're learning even meat eaters. It can cause some problems with your blood, with your neurological system, with your homocysteine, which is related to heart attacks. When we come back, we'll continue talking about not only the problems it can cause, but what to do to avoid them. Join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. George Guthrie. If you just joined us, I'm Don McIntosh. Thanks for watching Health for a Lifetime. But we're talking with Dr. George Guthrie. He is a physician from the Lifestyle Center of America. He's been a physician for over 25 years and seeing patients of all types, probably someone a lot like you. And we're glad you're with us today, Doctor.
Thank you, Don.
You know, I heard you talking during the break with somebody, and they were telling you some different things, and you just, it's like you heard it before because you've talked to so many different people. And there at the Lifestyle Center, you said that they do a lot of lifestyle medicine, which I guess is treating things from perspective of what you do day in, day out.
Takes the responsibility from the doctor and puts it on the patient. If I can educate the patient what to do, the doctor now is an educator, and the patient can do their responsibility. They can avoid and even reverse many of their disease processes.
I visited your website there, Lifestyle Center of America. You just put in any search engine, it comes up number 1, 2, or 3. And you have a lot of different programs there. And you also have some, I noticed on the website, you have a lot of helpful, what would you say, self-diagnosis tests people can take, whether or not they need your program or not.
Yes, a little marketing piece that looks at, for example, diabetes. Could you use some help in managing that, lowering your medication use?
I was buying a car the other day, which I don't do often, and I was there, and my salesman was talking with me, and he told me some of his health problems, and I said, you really should look in going to the Lifestyle Center of America. He said, well, what is that? I said, well, let's pull it up. I pulled it up. I was happy to find, I was trying to figure out, there was a test there. I gave him the little test and everything, and he told me, he says, I'm going to call him up. I don't know if he ever did. But it's very accessible, you know, wherever you are. Today, particularly, though, we're talking about the Lifestyle Center of America and its experience that you've had also as a clinician with vitamin B12 deficiency. I'm giving myself a test, and you tell me if I'm right or wrong. Vitamin B12 is a vitamin.
Yes.
The body doesn't make it, but little tiny, teeny bacteria make it.
Yes.
If you don't brush your teeth, you have more of it.
Oh, you weren't supposed to quote me on that one, Don.
So, no, it's made by the bacteria in your mouth or in your colon. And most of the time, people think they should get it from eating meat products because it's in the tissues of the meat.
The absorption of vitamin B12 is really rather complicated.
Okay.
It's almost fun. I like to think of it in football terms. Okay. Vitamin B12 enters the mouth.
All right.
There's an R factor in the saliva that grabs onto it. Now,
R factor, what's that mean, like raunchy?
It's a protein.
Okay, protein.
The scientists simply call it, the physiologists call it an R factor.
The R
it's
factor.
supposed to grab onto the vitamin B12.
Because
now,
it likes it, needs it.
Because it needs it. Now, in order for that to happen, the teeth kind of have to break up whatever it's in, right? And if it's in, for example, meat, you've got to chew it, turkey. You've got to chew it up hard, and then as the B12 comes loose from the meat, the R factor will grab it. It takes it through the stomach. Now, there's a lot of acid in the stomach.
Got to protect it
and
from
the
acid.
vitamin B12 might be damaged by the acid, so the R factor is protecting it.
Cradle like a little baby.
That's right. Now, kind of like, yeah. Once it gets through the stomach, there's a lateral that takes place. You see, in the stomach, there's something called intrinsic factor that's made by the lining of the stomach. And the R factor hands the B12 over to the intrinsic factor, and intrinsic factor carries B12 down to the end zone. That is, the end of the small intestine, and it's absorbed right there at the end. So you see, the absorption of vitamin B12 could have problems at a lot of different levels.
Right, just like a football player can get sacked behind the goal line. All right.
That's right.
Okay.
But it could be that there's a problem chewing. It could be that the saliva, there's not as much saliva as maybe there used to be. You know, as we get older, there's less saliva. There's a lot of medications that people take that actually dry up the saliva. What if someone was losing some teeth and had a hard time chewing? You see, the B12 may not be available for binding to the R factor. The R factor might not be there. Then it runs to the stomach, and we have this intrinsic factor, which is to be made by the lining cells of the stomach.
That could go wrong.
Well, don't we take medications to decrease the acid in our stomach?
Yeah, some of us more than others.
Some more than others, but there may very well be a problem with intrinsic factor. And then, of course, relatively rarely are people who have had pieces of their small intestine removed, especially the distal end for like Crohn's disease or those types of things.
Or maybe radiation treatment.
Or radiation treatment. So there's poor absorption at the end. So there's a variety of things that can get in the way, hence leaving quite a few people at risk, especially as we get older.
Now, you were talking to me something about Hindus and vitamin B12.
Oh, yeah. Yeah, that's really interesting. You may remember that Hindus, by their, I guess, religious belief, we could say, have no animal products. They're 100%.
They're the ones that say, holy cow, and they mean it.
I guess they do. I guess
Right.
they do. When they live in India, there's no vitamin B12 deficiency at all.
No,
But
there's
no,
none there.
They're not having it.
Okay.
But at the same time, when they move to England, they get B12 deficiency.
They must not be bathing in the Ganges River. There's a lot of bacteria there.
Well, that seems to be the difference.
Is that the difference?
There's a lot of cleanliness. You know, the food that has been very carefully processed in the grocery store in Western world, whereas back in native India, they were growing their own. There was the bacteria from the soil were putting enough B12. If you go out to the garden, your garden, pull your carrot, wipe it off, and bite it, there's going to be some bacteria on there that will provide B12 for you.
Okay, so the lesson here is be dirty.
Maybe that's another one of those reasons why older folks tend to have B12 deficiency, and the younger folks, you know, the kids, they tend to put all kinds of things in their mouths.
So there is a little bit from the earth and different things. Someone
That's
told
right.
me once, if you want B12, eat dirt.
Yeah, I suppose, but that's not something that I stomach very well, Don.
Now, what's your experience been? You see a lot of patients. You were in practice yourself. You taught at the School of Health. What's been your experience with vitamin B12 deficiency?
Well, after I taught at the School of Public Health, or while I was there was a study going on vitamin B12 deficiency. I wasn't part of the study. I wasn't part of the team, but I was listening. And so I was interested in this. I went from there and spent almost 7 years in the mountains of the Sierra in a small practice, and I was looking for...
Oh, we feel really bad for you having to be up there in the mountains like that.
Yeah, it was hard.
So you were looking for...
But I was looking for, because I had been sensitized to it, any symptoms that might look like vitamin B12 deficiency. And over the 6.5, 7 years, I ended up diagnosing 40 different people with vitamin B12 deficiency.
In 7 years?
In 7 years.
Quite a bit.
Now, this is in no way a scientific study, you understand. This is simply my own experience. I was attuned to look, and any time it came to mind, I said, well, let's get a B12 level. And so I checked vitamin B12 levels on a lot of people. 40 of them diagnosed as deficient. Only one of those claimed to eat only a 100% plant-based diet.
So most of them were, like you said, meat eaters can have this problem too.
Right.
Most of them, when your experience were. Yeah, I think you have some graphics on this.
Well, let me explain a little bit about those before we flip them on. What I did was to try to find out something about these patients and learn something. I went through and tried to find their presenting symptom. Now, when a doctor says presenting symptom, what you're talking about is the symptoms that they're complaining about when they come in, and other things that I may have discovered, complaints that they had when they came into the visit that I made the diagnosis or got the blood test. Now, obviously, this is reflecting my ideas because I was attuned to it.
Right.
But as I went back and looked at those that are actually found positive, I found a very interesting kind of pattern, if we might say. In my training, as I pointed out, I looked for anemia, large-celled anemia. That was the most common cause or diagnosis tool that I was taught. Well, I found a different diagnostic pattern. Let's show that graphic and see what it looks like. You can see that I divided the group up into 4, we call them quartiles. I took all 40 of them and divided up according to their level of vitamin B12 deficiency. The lowest would be the lowest quartile, and the highest, of course, would be the highest, and it would be just below normal. So we look at those symptoms, and you see the top 90% of them had a neurological symptom, and it correlated first, second, third, and fourth quartile. So those first two, the ones that had the lowest vitamin B12 levels,
always had that,
seemed to have the highest number of amount of low B12. Then I divided the neurological up into mental and neuropathy types. Now, mental is kind of anxiety, nervousness. I think the next slide will show something about that. And then neuropathy is shooting pains, things that you feel, back pain, those types of things. And so 30% of those had those particular symptoms.
And then 59% you said the mental ones.
Yes, and recognize that you put the two together and it makes the neurological. Both of the bottom groups were included in the top one. I just broke those apart.
Okay, so that you saw a real relationship between this.
And as I reviewed those, this is of interest. It's not a scientific study that's publishable, but it was interesting to me, and it might be interesting to our the viewers as well. I think the next graphic shows us some of these symptoms. With the neurological, you had the foot drop, sciatica, that is back pain, hyposthesia, which means, it's not quite spelled right there, but hyposthesia means that the skin is extra sensitive to touch. It hurts to touch it very lightly. Dizziness, fainting, muscle weakness, poor coordination.
Okay.
And so several different symptoms that actually came presenting. I even had a neighbor come in, since I was practicing in the mountains. Here, one of my patients, one of my neighbors came in. Her family brought her in. They said, "Mom's not acting right. You know, I wonder if she's got Alzheimer's." So we did this whole workup, including vitamin B12, and the laboratory says, we can't measure it.
Can't measure it.
Can't measure it. It's not there. Or it was so low they couldn't measure it. So we, of course, replaced that vigorously.
So we've got about a minute and a half left. What should we do to avoid vitamin B12 deficiency?
Well, I think probably the first thing is to be aware that vitamin B12 deficiency happens.
Okay, number one.
Especially, you're at risk if you are eating a 100% plant-based diet.
Get some dirt there.
Okay. Grow your own.
Right, okay.
Don't clean it quite so well.
Right.
There's even some evidence that a group of Seventh-day Adventist ministers in Australia who had more lacto-ovo-vegetarian diet had more vitamin B12 deficiency. So even people on the lacto-ovo may have problems. But if you're a meat eater and you're on a lot of medications and your health isn't well, it might be worthwhile having it checked. A screening test. It's not that expensive, and having that level checked may very well be able to save you problems.
So it's spelled out in some cereals like Total and other things.
Yes.
They actually have it spelled out, and you can make sure there's also some milk substitutes that have it in it so that you can make sure and always get enough.
Sure, and you can absorb. As a matter of fact, that little vitamin spray they spray on those cereals, you know, so many essential vitamins added, the B12 from those is really very well absorbed.
Well, thank you, Dr. Guthrie, for being with us today. Thank you for dedicating your life to this kind of thing. It means a lot to us. And thank you also for joining us on Health for a Lifetime. You've heard about vitamin B12 deficiency. It can cause real problems, so take it seriously. If you're having some of those symptoms that the doctor mentioned, get it checked out. And you've learned also what you can do to avoid it. Thanks for watching Health for a Lifetime, and may God bless you.